Union Health Minister JP Nadda today unveiling the National Health Policy. The policy was in the making, well, not exactly this policy, but we've required a new policy and it's been in the making for 15 years. Finally seeing the light of the day today, positioning it as a patient-centric policy. The Health Minister said that this policy focuses on preventive healthcare and pushes for more involvement of the government. Let's take a look at the highlights.
The Cabinet has approved the National Health Policy 2017.
The much-awaited health policy was announced, promising affordable healthcare to all. The three key objectives of the policy are increased government spending on health, improving the primary healthcare system, and pushing for affordable healthcare. The biggest need was to increase government spending on health because as compared even to Sri Lanka or Nepal that spend more than 2% on health and have a more robust healthcare model, India spends a meager 1.2% of GDP on healthcare right now. The policy now proposes to push up the spending to 2.5% of GDP by 2025. But the push is to expand primary healthcare and hence more than two-thirds increase in allocation for primary healthcare. The government has also set an ambitious target to build infrastructure so as to provide 2 beds per thousand population, a much-needed thrust from the current 0.9 beds per thousand population. A health card for all is also on the anvil. The government aims to provide free medicines, diagnostics, emergency care and healthcare services in all public hospitals. But where it may see headwinds, the government intends to rope in private sector. To bring down out-of-pocket expenditure on advanced treatments, the government is looking at strategic purchases from private sector on secondary and tertiary care. A key move is to regulate healthcare delivery, where the policy proposes to set up a national healthcare standards organization that will set standard guidelines for care and protocols for hospitals. The regulator will also grade both public and private hospitals to help patients make an informed choice. The government says it has set stiff targets for eliminating diseases like Kala Azar, lymphatic filariasis, leprosy by 2018. That's not all. The policy aims to strengthen healthcare so as to improve on some of its worst performing health indicators, like improving life expectancy to 70 years, reducing total fertility rate to 2.1, reducing under 5 mortality to 23 by 2025, reducing maternal mortality to 100 by 2020, and reducing infant mortality to 28 by 2019. While the government is confident of meeting its stiff targets, how it intends to bridge the gap between the centre and state-level health goals remains a big question. This because health is a state subject and wide gaps are visible between states that have implemented good schemes and seen improved outcomes and those that are laggards. In Mumbai, Archana Shukla.